Taking a medication every day and seeing your numbers improve can feel like control. It can feel like the problem has been handled. But in medicine, feeling stable and being stable are not always the same thing. I'm Dr. Warren Hung. In clinical practice, one of the patterns I pay close attention to is not when a condition gets worse quickly, but when it appears quiet, controlled, and uneventful, while something else is slowly changing underneath. If you find this kind of explanation helpful, clear, practical, and grounded in how the body actually works, consider subscribing. This channel is here to help you understand what your body is doing before problems become harder to reverse. Now, when it comes to blood pressure medication, the goal is straightforward: reduce pressure inside the arteries. And many medications do that very effectively. They lower the numbers you see on a monitor. They reduce measurable strain on blood vessel walls. They can lower the risk of major events when used appropriately. But there is a second layer that is not always obvious. Because the body is not just a set of numbers, it is a system of balance. And when you adjust one part of that system, especially something as central as blood pressure, the body does not simply accept the change, it responds, it adapts, it compensates. Sometimes in ways you don't feel right away. Blood pressure itself is not just pressure. It is the result of several systems working together. How tightly your blood vessels are constricted. How much fluid is circulating in your body. How your kidneys regulate salt and water. How your nervous system signals your heart and vessels. How hormones like renin, angiotensin, and aldosterone adjust your internal balance. When a medication lowers blood pressure, it often does so by altering one or more of these systems. And that is where the quiet shift begins. Because lowering pressure is not the same as restoring the system to its original, natural balance. Sometimes it is achieved by relaxing blood vessels more than your body would naturally choose, increasing fluid loss through the kidneys, blocking specific hormonal signals, slowing heart response. Each of these can be appropriate, each can be beneficial, but each also changes how the body maintains stability. And early on, the body is very good at adapting. You may not feel anything unusual. You may actually feel reassured. The readings look better. The medication is working. There are no obvious symptoms. But adaptation does not always mean resolution. In fact, one of the most important ideas to understand is this: the body can maintain normal-looking numbers while quietly shifting the way it functions underneath. For example, if fluid balance is adjusted through medication, your kidneys may begin working differently to maintain electrolyte stability. If blood vessels are consistently relaxed, your body may adjust its signaling systems to compensate. If certain hormonal pathways are blocked, others may become more active to maintain equilibrium. These are not failures of the medication. They are normal biological responses, but they matter over time. And this becomes more important as the body's reserve changes. As people age, or if they have conditions like diabetes, kidney strain, or long-standing hypertension, the body becomes less flexible, less able to compensate smoothly. What used to be a small adjustment becomes a larger stress. What used to be silent becomes noticeable, but often only later. This is why in long-term cohort observations, such as data from studies like the Framingham Heart Study risk, is not only tied to blood pressure numbers themselves, but to how the underlying systems behave over time, including kidney function, vascular stiffness, and metabolic balance. So the goal is not just to lower the number. The goal is to support the system in a way that remains stable over years, not just weeks or months. And this is where a common misunderstanding can develop. A person may believe, my blood pressure is controlled, so the problem is solved. But in reality, what has happened is that one visible measure has improved, while several invisible adjustments may still be unfolding. These adjustments are often small at first. A slight change in fluid balance. A subtle shift in electrolyte levels. A mild change in how quickly the body responds to pressure changes. None of these will necessarily cause immediate concern, but they can begin to influence energy levels, stability when standing or moving, kidney workload, how the heart and vessels respond under stress. And because these changes develop gradually, they are easy to miss, especially if no one is actively looking for them. This is why, in clinical settings, we do not only track blood pressure numbers, we also monitor kidney function through blood tests, electrolyte levels like sodium and potassium, how patients feel during normal daily activity, how stable they are with position changes, whether new symptoms have appeared subtly over time. Because sometimes the earliest signals are not dramatic. They show up as feeling slightly more tired than usual, occasional lightheadedness when standing, reduced tolerance for heat or exertion, changes that are easy to dismiss or attribute to age. And yet, these small signals often reflect real physiological shifts. What makes this especially important is that the medication itself is not the problem. The issue is how it interacts with a living system over time. A medication can be both helpful and something that requires ongoing adjustment. Those two ideas are not in conflict. They are part of the same reality. So the real question is not, is this medication good or bad? The better question is, what is this medication changing inside the body, and how is my body responding to it over time? Because that is where the early signals live. And that is where problems can be prevented before they become harder to reverse. But to understand that clearly, we need to look more closely at what these medications are actually doing inside the body at the level of fluid, electrolytes, and vascular control. When a blood pressure medication is prescribed, the focus is usually on one outcome, lowering the pressure inside the arteries. But to understand what that really means, you have to look at how the body creates and regulates that pressure in the first place. Blood pressure is not produced by a single organ. It is the result of coordination between the heart, blood vessels, kidneys, and several hormone systems that continuously adjust fluid and vascular tone. So when a medication lowers blood pressure, it does not act in isolation. It changes how one or more of these systems behave. And that change creates a chain reaction. Let's break down the first set of hidden changes that often occur, changes that are common, clinically important, and frequently overlooked because they develop gradually. 1. Fluid balance shifts. What the body loses quietly. Many blood pressure medications, especially diuretics, lower pressure by helping the body remove excess fluid. At first, this makes sense. Less fluid in the bloodstream means less volume pushing against vessel walls. Pressure goes down. But fluid in the body is not just extra. It is carefully regulated to support circulation, temperature control, kidney filtration, cellular function. When fluid is reduced, even slightly, the body begins to adjust. The kidneys respond by activating systems designed to conserve fluid, including the renin-angiotensin-aldosterone system, often abbreviated as RAAS. This system signals the body to retain sodium and water to restore balance. So while the medication is removing fluid, the body is quietly trying to hold on to it. This creates a kind of internal negotiation. Over time, this can lead to fluctuations in hydration status, subtle strain on kidney regulation, increased sensitivity to dehydration, especially in heat or illness. You may not notice this directly, but you might feel more tired in warm environments, slightly weaker during physical activity, less tolerant of skipped meals or reduced fluid intake. These are not dramatic symptoms, but they are signals that the system is working harder to maintain balance. 2. Electrolyte changes. Small numbers, real consequences. Electrolytes are minerals in the blood such as sodium and potassium that help control nerve signals, muscle function, and fluid balance. When certain blood pressure medications affect the kidneys, they also influence how these electrolytes are handled. For example, diuretics can lower potassium levels. Some medications can increase potassium levels. Sodium levels may shift depending on fluid changes. Even small changes in these levels can affect how the body feels and functions. Low potassium, for instance, may lead to muscle weakness, fatigue, irregular heart rhythms in more advanced cases. High potassium, on the other hand, can affect how the heart conducts electrical signals. These are not theoretical concerns. Guidelines from organizations like the American Heart Association, AHA, and the American College of Cardiology, ACC, emphasize regular monitoring of electrolytes in patients taking certain blood pressure medications, precisely because these shifts can occur without clear symptoms early on. In practice, what often happens is this. The medication is working. The blood pressure improves. The patient feels generally fine. But electrolyte levels may be drifting slightly outside their ideal range. Not enough to cause immediate alarm, but enough to change how the body performs under stress. And over time, these small shifts can accumulate. 3. Vascular response changes. When blood vessels stay relaxed. Some blood pressure medications work by relaxing blood vessels, making it easier for blood to flow. This reduces resistance. And again, pressure drops. But blood vessels are not meant to stay in one fixed state. They are designed to adjust moment by moment, tightening when you stand up, relaxing when you rest, responding to temperature, stress, and activity. When medication keeps vessels consistently more relaxed, the body may adjust its internal signaling to compensate. This can lead to a reduced ability to respond quickly to changes in position. You might notice lightheadedness when standing up quickly, a brief sense of imbalance, a delay in feeling fully steady. This is often referred to clinically as orthostatic changes when blood pressure does not adjust quickly enough during position shifts. According to clinical observations and guideline discussions in both ACC, AHA, and European Society of Cardiology (ESC) recommendations, this effect is more common in older adults, individuals on multiple medications, those with reduced autonomic response. Again, this does not mean the medication is inappropriate. It means the body's response is evolving. 4. Hormonal compensation, the system pushes back. One of the most important hidden changes involves hormones. The body has built-in systems designed to maintain blood pressure within a certain range. When medication lowers pressure, the body may respond by activating these systems. One key pathway is the RAS system mentioned earlier. Another involves the sympathetic nervous system, which controls fight or flight responses. When these systems are activated, the body may increase heart rate slightly. Blood vessels may receive signals to tighten. Fluid retention mechanisms may increase. In some cases, this compensation is mild and balanced. In others, especially over long periods, it can create a cycle where medication lowers pressure, the body compensates. Additional adjustments are needed. This is one reason why treatment plans often evolve over time, not because the original approach failed, but because the body adapted. Large-scale studies and long-term follow-ups, including analyses from cohorts like NHANES, National Health and Nutrition Examination Survey, show that hypertension management is rarely static. It requires periodic reassessment because both the condition and the body's response change. When you look at all of these together, fluid shifts, electrolyte balance, vascular response, and hormonal compensation, you begin to see a pattern. The medication is not simply lowering a number. It is reshaping how multiple systems interact. And early on, this reshaping is quiet. The body compensates well. The changes are small. The signals are subtle, which is why many people feel reassured during this phase. But the absence of symptoms does not always mean the absence of change. It often means the body is still managing those changes. And the real question becomes, what happens when that ability to compensate starts to weaken? Because the next layer of this process is not just about adjustment, it is about what happens when the system is under pressure for long enough that small shifts begin to affect organs like the kidneys and the heart more directly. By the time blood pressure numbers look controlled, a certain level of trust usually develops. The readings are better, the routine is established, the medication is doing what it was meant to do. But in clinical practice, this is often the point where a different question becomes more important. Not just, what is the number? But, how is the body maintaining that number? Because over time, the way the body sustains that lower pressure can begin to matter as much as the pressure itself. And this is where deeper effects can begin to show, especially in systems that rely on consistent, well-regulated blood flow. 1. Kidney strain, when filtration becomes more demanding. The kidneys are one of the most sensitive organs when it comes to blood pressure. They rely on steady flow to filter waste, regulate electrolytes, and maintain fluid balance. When blood pressure is lowered, especially over long periods, the kidneys adjust how they filter blood. In many cases, this is beneficial. It can reduce long-term damage from high pressure. But if the balance shifts too far, or if the body's ability to regulate declines, filtration can become less efficient. This does not usually cause immediate symptoms. Instead, it shows up gradually. Slight changes in blood markers like creatinine, reduced filtration rate, often referred to as eGFR, increased sensitivity to dehydration or illness. Guidelines from organizations like the Kidney Disease, Improving Global Outcomes, KDIGO Group, and the American College of Cardiology emphasize monitoring kidney function in patients on long-term blood pressure therapy, precisely because these changes can occur without obvious warning signs. What makes this important is that the kidneys are not just passive filters. They are regulators. They help control fluid balance, electrolyte levels, blood pressure itself, So, when kidney function becomes strained even slightly, it can begin to affect the entire system. 2. Reduced tissue perfusion. When delivery becomes less efficient, blood pressure is not just about protecting blood vessels. It is also about ensuring that tissues receive enough oxygen and nutrients. This is called perfusion. When pressure is lowered too aggressively, or when the body's ability to adjust is reduced, some tissues may receive less blood flow than they need, especially during moments of demand. This can affect the brain, muscles, kidneys, even the heart itself under certain conditions. You may notice this as fatigue that feels out of proportion to activity, reduced exercise tolerance, a sense that recovery takes longer than it used to. These are not always recognized as blood pressure related, but they often reflect how well or how efficiently blood is being delivered where it is needed. In older adults, this becomes more important. As the body ages, blood vessels become less flexible. The ability to rapidly adjust flow decreases. So the same medication effect that was well tolerated earlier may begin to feel different over time. European Society of Cardiology (ESC) guidelines highlight this balance, emphasizing that treatment should reduce risk without compromising adequate perfusion, especially in vulnerable populations. 3. Compensatory hormonal activity. When the system stays activated, earlier we discussed how the body compensates when blood pressure is lowered. Over time, that compensation can become more persistent. Instead of occasional adjustments, the system may remain partially activated. This means stress-related signaling pathways may stay more engaged. Fluid retention signals may continue cycling. Vascular tone may fluctuate more than expected. This does not always cause obvious symptoms, but it can create a background state where the body is working harder to maintain balance. And in some cases, this contributes to variability in blood pressure readings, increased sensitivity to changes in medication or hydration, a feeling that stability is harder to maintain than before. Large observational datasets, including long-term analyses from cohorts like the Framingham Heart Study and NHANES, show that variability, not just average blood pressure, is associated with outcomes over time. That variability often reflects how stable the system truly is underneath. At this point, it becomes easier to understand why controlled does not always mean optimized. Because control is a surface measure, optimization is about how the system functions as a whole. A brief clinical example. I remember a patient in his early 70s who had been on blood pressure medication for several years. His readings were consistently within target range. On paper, everything looked stable, but he mentioned something that seemed minor at first. He felt slightly unsteady when getting out of bed in the morning. Not enough to fall, not enough to worry him, just a brief moment where he needed to pause. Over time, he also noticed that his energy during the day was lower than it used to be. Nothing dramatic, just a gradual shift. When we looked closer, his blood pressure was well controlled, but his system was adjusting in ways that were no longer as smooth as before. His body was maintaining the number, but with less flexibility. And this illustrates something important about how the body works. The absence of major symptoms does not always mean the system is functioning optimally. Sometimes, it means the system is compensating. 4. Why this becomes more important over time. These changes do not usually happen suddenly. They develop gradually, and that is why they are often missed, especially in people who have been on the same medication for years, have stable readings, feel generally fine. But as the body's reserve changes with age, with metabolic conditions, or with cumulative stress, small inefficiencies begin to matter more. The system becomes less forgiving, less adaptable, more sensitive to shifts that once would have been absorbed without notice. This is why ongoing evaluation matters. Not because something is wrong, but because the system is dynamic, and what worked well 5 years ago may need adjustment today. So when we talk about blood pressure treatment, the real goal is not just control, it is balance. A balance between reducing harmful pressure, maintaining adequate perfusion, supporting kidney function, preserving the body's ability to adapt, and that balance is not fixed. It changes over time, which leads to the most practical question. How do you recognize these shifts early, and what can you actually do to stay ahead of them before they become harder to correct? By this point, the goal should feel different. Not just lowering a number, not just staying within a target range, but understanding how your body is maintaining that number and whether that system is still working smoothly. Because most of the changes we've discussed do not appear suddenly. They show up early, quietly, and in ways that are easy to overlook. So the question becomes, what should you actually pay attention to in real life? 1. Recognizing the early signals. The first signs are rarely dramatic. They are usually small shifts in how you feel during normal routines. Things like needing a moment before standing up fully, feeling slightly more fatigued during the day, reduced tolerance to heat or dehydration, subtle weakness, or lower stamina during activity. These are not specific to one condition, but when they appear gradually, especially after being stable for a long time, they often reflect a change in how the body is regulating itself. One of the most overlooked patterns is this. Symptoms that are consistent but mild tend to be dismissed. People adapt to them. They become part of the background. But in clinical practice, those background changes are often the earliest indicators that something has shifted physiologically. 2. What to monitor beyond the blood pressure number. Blood pressure readings are important, but they are only one part of the picture. To understand how well your system is functioning, it helps to look at a few additional markers. These are commonly monitored in routine care and recommended by major guidelines such as those from the American Heart Association, AHA, American College of Cardiology, ACC, and kidney disease. Improving global outcomes, KDIGO. Kidney function, creatinine, eGFR, shows how efficiently your kidneys are filtering blood. Electrolytes, sodium, potassium, reflect how your body is managing fluid and cellular balance. Blood pressure variability, not just the average number, but how much it fluctuates. Orthostatic response, how your blood pressure and heart rate respond when you move from sitting or lying to standing. These are not advanced or unusual tests. They are part of standard monitoring, but they are often spaced out over time. And unless there is a reason to look closely, small trends may go unnoticed. 3. Questions that help reveal what's changing. One of the most practical ways to stay ahead of these shifts is not through more testing, but through better questions. Questions that focus on how your body is functioning, not just what the numbers show. For example, has your energy level changed over the past several months? Do you feel steady when standing up quickly? Has your tolerance for heat, exercise, or missed meals changed? Are you noticing subtle symptoms that weren't there before? These are simple questions, but they often reveal patterns that numbers alone do not, and they give your clinician more context to interpret what's happening. 4. Understanding medication as part of a system. One of the most important mindset shifts is this. A blood pressure medication is not a standalone solution. It is one part of a larger system. That system includes kidney function, vascular flexibility, hydration status, metabolic health, nervous system balance. Over time, each of these can change, which means the role of the medication may also need to change. This is why treatment plans are often adjusted, not because something has gone wrong, but because the system has evolved. And this is supported by long-term clinical data. Guideline updates from organizations like the ACC, AHA, and ESC emphasize individualized treatment adjusting therapy based not only on target numbers, but on how the patient responds over time. 5. A practical framework you can use. To make this actionable, it helps to think in terms of a simple framework. Observe, connect, act. Observe. Pay attention to consistent, subtle changes in how you feel. Not dramatic symptoms, but patterns. Connect. Ask whether these changes could be related to how your body is regulating blood pressure, fluid, or energy. Act. Bring these observations into your next medical conversation, not as concerns to alarm, but as data to refine your care. This approach turns passive monitoring into active understanding. 6. What this means going forward. The goal is not to become anxious about medication, and it is not to assume something is wrong. The goal is awareness. Because when changes are recognized early, adjustments are usually simple, systems can be rebalanced more easily, complications are more likely to be avoided, and when they are missed, small issues can become more difficult to correct. The system becomes less flexible over time. So the most important takeaway is not a warning. It is a shift in perspective. Blood pressure control is not a finish line. It is an ongoing process. A process that works best when numbers are tracked, systems are monitored, and subtle changes are taken seriously. If this kind of clear, clinically grounded explanation helps you understand your health more confidently, consider subscribing. The goal here is to give you the tools to recognize patterns early while they are still easy to manage. And before you go, I'm curious, was there a symptom or pattern in this discussion that felt familiar to you, even in a small way?